Dr. Dara Kass joins me now. She's an emergency room doctor and medical contributor for Yahoo News. Dr. Kass, welcome. Great to have you with us. So the U.S. has reached two frightening milestones in the past 24 hours. First, more than 15 million confirmed cases nationwide, and the country is now averaging more than 200,000 new cases of COVID-19 on a daily basis. So despite the good news of a vaccine release that is on the horizon, what do Americans need to do every day from now until they get vaccinated to slow the spread of the virus?
They need to still be smart. They need to wear their mask, obviously distance from people not in their nuclear families, and they need to stay home as much as possible while prioritizing the activities we want to keep going, like schools for our children and the essential businesses we need. We are seeing a critical surge in hospitalizations, in ICU stays, and in deaths. That's really going to undermine our ability to take care of every new patient as they get infected. The vaccine is here. It's not even just coming. But remember, it takes about 6 weeks for somebody to be fully vaccinated from the time they start the process to the time they finish. So it's going to be a while before a critical mass of Americans are fully vaccinated. And we've got to keep going and stay safe until we get there.
And Dr. Kass, in the UK, the National Health Service was told not to give the Pfizer vaccine to people with a significant history of allergic reaction. This happened, I guess, after two people had some kind of allergic reaction to taking the first dose of the vaccine. What do we know about the impact the vaccine had on those patients, and how might that impact the U.S.'s approval process?
So we actually don't know very much about what happened to those two patients in that first day. We know that Pfizer said that they had removed anybody from the trial who had a history of a reaction to the component parts of the vaccine. And it's unclear if these two patients had a reaction that was related to component parts of the vaccine or if this is somehow unrelated. It's called an anaphylactoid reaction, which is a little different than the allergic reactions we're used to. What we know is it's notable to watch, and we need to know more information. And I'm sure that our regulators will act in accordance with whatever information we get. But this is not something that happened during any of the clinical trials.
Interesting, because of course this is such a, this entire virus and the vaccination process, it's sort of a learn as we go procedure here, because we're really, in new territory in a lot of ways. But we are, of course, 9 months into the pandemic, and there is still no centralized database to distribute medical gear to health providers across the country. There are currently more than 104,000 Americans hospitalized with coronavirus, and PPE shortages are being reported nationwide. How significant is this issue, and what are you seeing personally in your own emergency room?
So it's very significant, and it's been a problem since day one, especially for rural hospitals or hospitals not part of large systems. I work at a very large hospital system that's been able to prepare and has been prepared since the beginning for PPE. But that's not true for many, many healthcare workers on the front line, especially as they go into ambulances and off-site. This is one of the two major operational failures of this administration, one of which was, the failure for PPE procurement and making sure that we had a coordinated effort. And obviously, the other one is around testing. Neither of these are the creation of the new vaccine. And, the idea that we failed on both of these fronts just massively is extraordinarily disappointing, and one that I'm hoping will be corrected with the new administration.
And once the coronavirus vaccine is distributed, what will you be looking for from that first batch of recipients?
So obviously, we're going to look for any hesitations, any side effects, any operational issues around delivery of the vaccine and the storage of the vaccine and how many people need to get vaccinated at any one period of time, making sure that people know how to get to that second appointment and see how many people actually fall off between the first and second vaccine, so we have a better structure as far as following up patients and making sure they're there. I'm very optimistic about this vaccine, and I'm very optimistic about the Moderna vaccine coming and the other few that are coming down the pipeline. I think that we are very close to getting a critical mass of Americans vaccinated, and I'm very excited to be part of that solution, but it's going to take time. We're not going to see this probably until the summer, where we're going to see enough people vaccinated to make a difference in our lives. So we're going to have to stay strong, and we're going to have to wear our masks, stay distanced, and really prioritize public health for now.
And Dr. Kass, for the average American, where can they anticipate they will be getting the vaccine? Will they be going into a CVS? Will they be going into their, primary health care provider? How will that work for the average American?
So it's going to really depend on where you live. The way the plan so far, as best as we know, is that states will get an allocation of vaccine, and then within that state, they're going to decide how to distribute it. And it may be through partners like CVS and Walgreens, but a lot of communities don't have one of those large box, pharmacies, and it may be a hospital center, it may be a vaccination center, like taking an airport hangar and putting the refrigeration in there, and it may be even mobile units. The most important thing for vaccination strategy is to stay plugged into your local community and understand from your governor and your mayor where the vaccine will be available to you and how it will be distributed, and then find out where you sit in the priority structure, which is very much related to the risk to you for getting sick or dying from this virus.
And for the average American, will this be covered by their health insurance?
Yeah, I believe so. I think that, a lot of these things haven't been publicized, but it seems as though this is covered by the government 100%. Actually, not the insurer, but actually the government, because they pre-purchased all these vaccines. So the delivery part of it is a little different maybe than the purchasing of the vaccine, but I don't believe there's going to be a cost to the end user for any of these vaccines.
All right, Dr. Dara Kass, thank you so much for your insight. We appreciate it.